As we hear every day about the impact of the pandemic, it is easy to start to tune things out. For example, for months now, I have been saying that we're all in this together, and I know that for many this phrase is wearing thin. For many people, this time we are in now is the most challenging moment in the pandemic so far. Few of us have ever lived through a time of adversity akin to what we are experiencing now, and hopefully we won't be tested like this again. But the phrase that I have often said is not a slogan. It is an irrefutable biological fact of COVID-19 that we cannot escape or choose to opt out of. COVID-19 shows us that a grocery store clerk is connected not only to the shopper, but also to the shopper's kids, their co-workers, and friends. It shines a light on the link between a long-term care resident and the worker who cares for them, as well as the worker's spouse, the co-workers of those spouses, and those co-workers' friends. COVID-19 doesn't care about anyone's race, religion, or political preferences. All that matters to it is whether an infectious person is close enough to another person for long enough to be able for the virus to spread. When cases rise, it is because we are infecting each other. When cases fall, it is because we are protecting each other. What we do with this reality is up to each of us. Business owners who choose to reopen, despite our current restrictions, are increasing the number of close contacts that happen in their community, possibly making it harder for other business owners if that means restrictions need to stay in place for longer. Business owners who prepare for a safe future reopening but follow the measures currently in place are helping their communities, protecting our healthcare system, and helping us get to a low enough level of community transmission so reopening can happen faster. Communities who support their business owners through this difficult time are making it easier for them to do the right thing. Twice now, we have reduced the rising spread by working together and bringing our contact numbers down. This is the only tool we have to control the spread of the virus until enough vaccine is available to protect a majority of our population. Until then, limiting in-person interaction is the best way to protect our health system and save lives. We are reducing the spread right now because of the choices that 4.4 million Albertans are making every day. It takes all of us. We are all impacted by the actions of those around us. It is by acknowledging we are all connected, by valuing those connections and strengthening them in any way we can, that we will get through the coming months. Like it or not, we cannot choose to opt out of community. We rise or fall together, and none of us can do this alone. What I would say about looking forward and predicting future trends is that the same message has always applied and continues to apply now, which is that as we're looking forward and considering what measures we might be able to ease at some point, that the actions that Albertans take once those measures are eased will determine our future. And so we are wanting to make sure, for example, that as we're easing measures, we're continuing to provide that messaging that no matter what activities Albertans engage in, they need to do so in a way that respects those public health guidelines, making sure that distancing is happening, masking is happening, that people stay home if they're sick, that they get tested if they're feeling ill, because ultimately if we open up and people are not following those measures and we start to see our cases rise again with a baseline of over 800 people in hospital across the province, we can very quickly get into a difficult situation again with respect to our acute care system. So in terms of our future, again, I think there's lots of reasons to be optimistic, and Albertans, again, have shown that when we've worked together and followed these restrictions, we have brought our cases down, and that's not true of all locations around the world, but we can't ease up on following those public health measures or our trends will start to rise again.